Hey y'all, welcome back to my YouTube. If you're new, thank you for coming to watch. If you're not new, thank you for coming back. I appreciate this so much. So it dawned on me, I have not posted a nursing update in over like 6 months. A lot of people have been asking me what's going on because, like I said, it's been over 6 months. Like, do I have a job? Do I not? Am I unemployed? Like, lots of questions, and I have answers. So the last time I made a video, I can't really specifically remember. I probably should have watched it, but I can't really remember what I said as far as like finding a job. I think I touched on like how the job market is trash, and it still is. But that day, in particular, I was interviewing for a job at like I think it was like it was a rehab, basically rehab / nursing home. I did not get the job back then. That was in like December, early December, I believe. What happened was I interviewed and then I never heard back from them. Like, that's so rude, annoying, not disrespectful, but it's just very unprofessional. So later down the line, those same people put a job ad out. Then they reached out to me again for an interview, and just by word of mouth, I asked people like, have you worked at this place? Blah, 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 should I work here? And lo and behold, I just didn't take the job. Anyway, so I think January rolled around, I applied for a nursing home that was about 30 minutes from me, and I got the job on the spot. So, oh my god, my nose itches. Hold on. Now, I did make a video about like the do's and don'ts when it comes to nursing homes and whatnot, because sometimes it'd be a little ghetto. But anyway, that nursing home, I ended up quitting. I think I worked for like a month and a half, but I just couldn't take it. Like, as a new grad, I felt like having over 20-something patients to start out was just like, God, like, how can you effectively learn how to be a nurse when you have that many patients? I mean, you might learn time management, but do you really get to do you get to take care of your patients efficiently without having to feel like you're always in a rush? That, and then barely having help on top of the bullies that be up in a nursing home. Like, one thing I will not tolerate is a dang on bully. Let me tell y'all how this lady tried to bully me so bad. So, of course, a lot of older people think because you look young and you're a new nurse that they can just say anything to you and treat you however, but I'm not that. So I was a nurse on this hall in particular, and there was a med aide. The med aide, like, I'm gonna make this story short because it's supposed to be an update, but I might keep talking because I can. So the med aide was an older black lady. We got to do better. So one day I came in, and I'm trying to remember all the situations because I think it was like 3 different situations. One day I came in and I was helping the nurse. I was giving medicine, or my preceptor, I should say. I was giving a lady some medicine. So I grabbed some pudding because the lady told me she wanted pudding, right? So I go ahead and I crush up the medicine. It was a pain medication she needed. So I start to get the pudding ready, and here comes the lady. You need to put that in applesauce. Put that in applesauce. I said, she just told me she wanted pudding. Does it really matter? If they say they want pudding, I'm going to give them what they want. So I just look at her, and I'm like, okay. So I grabbed the applesauce, the other med aide, because mind you, this med aide wouldn't even work on the floor. She just be up in there, just floating around, trying to say she helping, but she really not. Mind you, State was supposed to be coming, so she's supposed to be keeping an eye on this. I don't need nobody to keep an eye on me if they're not my supervisor. So I look at her crazy, and I'm like, okay. So I go down the hall, and now CNA is coming up to me and is like, somebody down the hall needs something is going on with them. And I'm like, okay, I don't even know this patient. Let me see what they have and stuff real quick, because the other nurse, I think, went on break or something like that. I don't know, but I went to go open the chart to go see what they needed or what they had, just so I could be prepared when I go in there to see, like, their pain level, assess what's going on, blah blah blah. And before I could even do that, the lady yells from down the hall, this med aide that's not even supposed to be working the floor, it was like, you can't just go give them medicine because they tell you to. You have to go look at them. And I look at her, and I look back at the person. I'm like, okay, do you know what I'm gonna do? Are you able to, like, get in my brain and tell me exactly what I'm doing right now? You don't know. So I'm looking at her again. I'm like, why does this lady keep picking with me? So now, moving on to another day, I come in. When I tell you this day was so crazy, y'all, I came in, I barely get a report, and one of the nurses is like, one of your patients is dead. And I'm like, my patients are dead? He's like, yeah, she passed away last night. She's down the hall. I'm like, okay, what do I need to do? Basically, he had did like the post-mortem paperwork and stuff, but I had to do the transfer to the funeral home, blah, blah, blah. Cool. So The lady's down the hall. I'm waiting for the funeral home to come. In the meantime, I'm going to have to go check my blood sugars and stuff and take care of the people down the hall before I go down there. In the midst of all of this, I guess a mayday called out. So this lady, sorry, I keep moving this phone too much. This lady came to help, the same mayday that keep picking with me, right? She comes to help, and first of all, she gets there, she's rude as a mug. I'm down the hall getting blood sugars. In the midst of me going to get blood sugars, I look over, and it's a lady about to fall off the bed, like she's hanging off the bed. So in the midst of me walking to like help her get her vitals and stuff like that, the lady's like, count. And I look down there, I'm like, what is she saying? I said, what? She's like, count the keys. I said, no. I said, good morning, first of all. I said, you don't talk to me like that. I said, if you want me to count, we could count. I said, first of all, you late. I already counted with the other nurse. I'm not counting with you again, or right now I'm busy. And she's like, no, you supposed to count me. If I want you to count me, you supposed to count me. I said, I don't gotta do nothing. I ain't gonna say nothing is not what I said. I was cussing this lady out at this point because I'm fed up because she didn't pick it with me for no reason. So I look in there, and the lady's like really about to hit her head on the floor. She's about to fall off the bed. So I'm going in there, and we arguing back and forth while I'm trying to like help this lady. Mind you, you need to bring your tail up in here and help me get this lady that's about to fall off the bed back onto the bed and straighten her up. But you only care about, you know, drama or whatever. So I'm bringing the Valentine card in there with me as I go in there. She gonna come there and throw her keys up in the cart. And I'm like, I just start laughing because I'm like, girl, that don't do nothing to me. You throwing your keys down like a toddler is not gonna do anything to me. So as she does that, I said, make sure you go get the ADON downstairs because he's the only one in the building. This is a weekend shift. I said, make sure you go get the ADON because you're finna go home. So she go down there, and my CNA was in the hallway. She seen the whole thing happen, and she went down there to see like what she was gonna say to the man. And she came up there and told me, basically, she was down there lying, said that I just started going off on her. She didn't know that CNA had been sitting behind her car watching. Basically, she provoked me, obviously. So I stood up for myself, and I told the man, and the man was like, he put me in a room. He was like, to be honest, he's like, I'm glad you stood up for yourself because she tends to bully a lot of nurses on this hall and they end up quitting. I'm like, yeah, and I'm finna quit too because I don't tolerate stuff like that. You're not gonna put me in a hostile environment and think I'm not gonna stand up for myself. I'm here to take care of people. I'm not here to sit up here and start drama and argue with coworkers. So I told him, I said, this hadn't even been the first time that she been picking on me. He's like, well, basically he was like, because I said, you can either deal with getting another nurse in here because I'm finna quit today, or you can get another medic. He was like, no, don't do that. I'll just, if you need narcotics, I'll go get them for you, blah, blah, blah. I'm like, I shouldn't have to work like that. So later on that day, I forgot what happened. No, she disappeared for like 3 hours, and you know the mayonnaise have the narcotics, so I had to go get the narcotics from her, and he was nowhere to be found. I mean, I had to go get whatever from him. I don't remember, but he was nowhere to be found. I don't care. I need to do my job. So she come back. I go in there. Ooh, something white on my face. Oh, well. I'll need a towel. I don't get no towel with me. Anyway, I go up there to get this stuff with the CNA. I'm like, here, you could just come with me and be my witness in case she tries something stupid. I go over there. I said, I need this for such and such. He been crying about the, he's in pain. He's crying, blah, blah, blah. She's on the phone with, I guess, our ADON, which is her little friend or whatever. I forgot that part of the story. That ADON I was talking to, he was like, well, she's not going to get fired because she's friends with the ADON up here. I'm like, dude, this is why I'm finna quit. So anyway, she threw the little medication log book at me, like on the thing towards me instead of handing it to me. And I looked at the CNA, and we look at each other, and I just started laughing because I'm like, you are too old to be acting like this. How much you got kids my age. You're acting like you're younger than my age. So okay, moving on. What happened next? I went on break, and I started coming up the elevator, and I guess she was talking to my CNA about what happened that morning, and all of a sudden, she's on the phone, mind you, while she talks to the CNA. So she says, I'm walking through that conversation. All of a sudden, she paused and say, she ain't gonna be satisfied until I slapped the out of her. So I stopped down the hallway. I turned around. I said, you talking to me? She's like, no. I'm like, this bitch. I'm like, yeah, you was talking to me. So I keep walking, and I go down there and tell the other nurse, and the other nurse is like, oh, I said, I'm gonna make a report on her. She's like, oh, you can make a report, but they're not gonna do anything about it. They never do. I said, yeah, see, I'm finna quit. I'm finna quit. And then another incident that happened before that, I forgot to mention this too. One time, she was just on the floor, like she wasn't scheduled to work the floor, but she was just up there, like just in the way. So I had to go get vitals on somebody, and I grabbed the vital signs cart, right? So I'm using it and I'm trying to write my stuff down. All of a sudden, she gonna come in the hallway. She grabs it as I'm writing it. So I snatch it back and I'm like, what are you doing? I said, I'm literally writing the vital signs down on the machine and you're taking it away. She's like, I need this for somebody. I'm like, no, you don't. I said, you're not working the floor. I said, what are you even trying to do? She's like, I'm trying to get vital signs for such and such down the hall. I said, no, you're not, because the med aide that's working the floor, she already got the vital signs for that person. I need this right now. So I go, she still takes the vital signs card down to the dining hall, and I go down there and I snatch it back. And she's like, wait a minute. I said no. And I kept rolling on because you about to piss me off. Like, I never get to the point where I want to throw hands to somebody. But in my mind, I'm like, I really want to punch this lady in the face. Like, you need somebody to punch you in the face and put you in check, but it's not going to be me. I'm not going to lose my license. Like, what? I'm not even a violent person for real, but she really, really made me want to slap her, like, bad. What made me also want to quit was the fact that I was always getting relieved late. Mind you, I live about 30 minutes away already, and I get off at 6, which is still like kind of rush hour traffic in the Dallas area. So I would get relieved like an hour late almost every single time I worked. And I'm like, and y'all don't even do nothing about this? Like, I can't stand people that just be late for no reason. Like, you have no valid excuse to be late every single time you work. None. So shortly after, I think, that incident, I quit. Like, I didn't even send them a 2-week notice because I feel like they didn't deserve that. So I sent them a notice in, and then I just didn't come back. Like, people always say, like, you need to send your 2-week notice in or they're not going to rehire you. And I'm like, I don't want to be rehired. If I wanted to be rehired, they would know. I don't want to be rehired there. So moving on down the line, I think about, not even a month later, I applied to so many places. Mind you, the job market was still tough. Like, I'm applying, and I'm not getting anything. So I finally I saw this ad for rehab. Yeah, I saw this ad for a rehabilitation. I saw this ad for a rehab hospital job, and I applied, and then I got an interview, and I got hired on the spot. But the only stipulation was, okay, you're gonna have to take a pay cut. I had to take like a $3 pay cut, which to me matters. I had to take a pay cut, but the patient workload, the patient ratio was going to be less, right? So I thought. So I started working this job in April, and I think the max we can get is 7. I would prefer 5 to 6, but I have gotten up to 8. And that 8, when I tell y'all, it literally drained the life out of me so bad to the point where I called off the next day because I didn't feel well. I had to rethink my life choices at that point. Like, do I even want to be a nurse anymore? The burnout was crazy. And a lot of times at this job, I get canceled a lot. And here, you don't get paid when you get canceled. So there's been days where, like, I didn't work for more than 9 days at one point. And I'm like, I can't pay the bills with this. What he say on Boondocks? How am I supposed to pay the bills? Like, I was like, I need a PRN or something. But I've been working that job for the last it's been 7.5 months now. I mean, I like rehab for the most part. I just feel like if my ratio stayed the same constantly, like if I had like 5 to 6 every day, I feel like I would feel a lot better. Like, I feel relieved when I come in and I have 5 to 6 patients versus if I have 7 to 8. I feel like I'm dragging throughout the day. It's just too much. And, of course, in rehab, you don't have med aids that's going to help you pass like the regular meds. Some people be having like more than 50 medicines. Like, you have to learn how to like do your time managed efficiently. And honestly, I'm going to say the job market still has not improved, in my opinion. Because literally at this job, I've applied to several jobs on Indeed or whatever the case is. It's taking them a while to get back to me, or I'm getting rejections here and there. It's just terrible in this area. I don't know if it's just Dallas or what, but the nursing shortage is still not a shortage as they say it is, honestly. And some days I leave work and I'm like, dang, do I really want to be a nurse, or do I want to switch to something else? And speaking of which, let me tell y'all about like my plans. So since I've been at this job, obviously I've learned like, okay, now I feel like I'm not getting paid as much as I think I should, or I know I should. I feel like that's just nurses across the whole spectrum. Like, we don't get paid what we deserve. So, and I had to take a pay cut as well. So I'm thinking to myself, I'm like, I don't think I'm going to go back to school sooner than I think. I told myself I was going to give myself a break, but I don't think I need to take breaks. I don't need to take a break. And I'm actually in the process of applying to RN schools. I just don't know what school I want to go to, because some schools require me to take micro again because I didn't have a lab portion attached when I took it at Northwestern State in Louisiana, I didn't have a lab attached to it. Some schools require me to take it again because I don't have the lab. Some schools don't, but some schools cost too much, or they're unorganized, etc., etc. And it's just like, or they're too far. Like if you live in the Dallas area, you know, like 30 minutes, 40 minutes, 50 minutes could make or break your commute every day. It could be a factor in timing, honestly. So I'm in a process of finding the school to go to because I'm so tired of like how low or little they pay LVNs in this area. It's honestly ridiculous. So yeah, I'm going to go back to school, and I'm trying to think of what else I want to do. I know I want to get my degree in interpreting. I want to be a medical interpreter, specifically in ASL, which is American Sign Language, if you don't know. So I do know sign language. So I am trying to figure out the timing of all of that. I still feel like I'm behind, even though I'm 29 years old. I've accomplished a lot so thus far. Like I've been in the military. I got my associate's degree in criminal justice, which is complete opposite of nursing, I know. But I'm starting to think to myself, like, okay, I have accomplished a lot, but I still feel like I need to get things done. I'm not trying to hurry up, but I want to get it done, like, in a hurry. I want to get it done. So, yeah, I already took my TEAS test again because some schools require you to take it every 2 years or every year, but then, like, you applying. I took the TEAS test in 2023. So, I did pass. I got a good score. So, hopefully, the rest of this goes smoothly because I am tired of this low pay. And then it's like not a lot of places, unless you're rehab / nursing homes or clinics, they don't really hire LVNs. And I kind of want to get into my dream specialty, which is, well, I should say specialties, which are labor and delivery, mother baby, pediatrics. Yeah, I can't really think of anything else. So I really do want to get into my dream specialty rather sooner than later. I feel like I would feel a lot better if I was doing something that I actually had a passion in, which is maternal health and pediatrics. Oh, and I forgot NICU, maybe. I don't know. I hear like mixed reviews about NICU, so I don't know. We'll see where I end up. But back to like the whole job situation, I forgot to mention to y'all too. So in my current job, it's like wherever you go, you cannot escape bullies. It does not matter. Like here in my current job, we do have to do wound care. Okay, fine, cool. I did wound care when I was at the nursing home, but there's a specific person that comes in that like kind of checks, takes pictures, you know, documents and stuff like that. It's a wound care NP. This lady, when I tell y'all, every time she comes in, she be picking with me. It's ridiculous. The first time I came, or the first day I was by myself, and obviously when you're by yourself for the first time, you're overwhelmed. I had just sat down to take a break and start charting. She came in to do her rounds, like, which was late as a mug anyway. But she came, I came and tried to sit down. No, I went to go try to sit down, and here she comes. I need you to come me to this room to assist with doing wound care. So we go in there. It's me and 2 other therapists and somebody else in there. I think the patient had just got there, so they're doing like evals and whatnot. Okay, whatever. So the lady's like, okay, so I think I need this, and that. I'm like, okay. She's like, can you go get it, or are you going to be too slow to go get it? Me and the other therapist, this black lady, we locked eyes and we made a face. I'm like, girl, if you know I'm new, you think I don't know where something is, you could just go get it, or you could have took the initiative to just go get it and show me where the things are instead of just being a little condescending. Like, that was weird. You weird. So moving on to another situation. This day, somebody called out, so all of us had extra patients. Like, some of us had 7 to 8, and the workload was tough. Like, the patients was sick. So I don't know. I think I went to go take a 15-minute break or something. I really don't remember because this was like several months ago now. She's like paging me down, but I don't know. She's asking for a nurse to come help her with the wound care. I go in there, mind you, I hadn't been at work. This matters. I hadn't been at work for 2 or 3 days, but I hadn't had time to do wound care yet. I hadn't even stopped passing my meds yet. Like, I just didn't have time to do it or whatever. So I go in there and she's like unraveling the wound. She's like, I changed the order for the wound care. The wound care hadn't been done in the past 2 days. I said, okay, I haven't even been here. I said, when I came in here, I did assess. I know I have to do wound care for her leg or whatever it was, but I just don't have the time right now. I have to finish passing these meds. So she starts saying, like, after I said I had been there, she just keeps going. She's like, but I changed the order. They didn't do it. And I'm like, okay, I just told you I wasn't here. And she just kept going. So I snapped on her in front of the patient. I don't like to do stuff like that. But sometimes I feel like you had to stand up for yourself then and there, or they're not going to stop. So she's like, after that, I said, do you talk to other nurses like this or just me? Because I just told you I wasn't here the past 2 or 3 days and you just keep going. I just told you what it was and you just kept on going. So after that, she didn't have much to say. She finished it and I said, okay, well, I'm done here helping you. And I left the room and removed myself from the situation. So then after that, she was pretty much nice to me. Thirsty. She was pretty much nicer to me. So moving down the line, recently I had a situation where, well, actually this was last week. She came in and I was in the room. Hold on, let me get my thoughts together, because hold up, that sip of water just got me kind of thrown off. I'm passing meds this time around. Of course, obviously I'm a lot better at time management and stuff, even though I have 7 patients. You know, I'm doing the thing. I'm in the patient's room trying to pass meds. I think this is my last patient I'm passing more than meds on because she went to therapy. Cool. I'm in there passing meds. This lady comes in there about 4 or 5 times to interrupt me, talking about another patient, talking about, oh, I need you to change. I'm changing their dress and blah, blah, blah. Because this lady that she's talking about, I had offered to change her dress when I was in the room, but she said she wanted the NP to do it because of something that she does. I never had this lady, so I'm like, okay, you know how you like it done best, so I'm gonna let her do it. So I'm in the other patient's room and she comes in there about 5 or 6 times and then she goes, I need you to get this, I need you to get that. And I'm like, don't you know where that stuff is? Why do I need to go get it? But I want to go get it real quick. So I'm like, okay. So I come back in and I'm trying to do something. No, I'm still trying to pass meds. And she's like, I need a wound culture stat. I need the kit. I'm like, okay. Like, is this I'm like, okay, I'll go get the kit or whatever. Like, do you not know where this stuff is? You know where this stuff is, because like I said in a situation before, she's like, are you going to go get the stuff or are you going to be too slow? So I'm like, okay. I'm walking down the hall. I'm like, are you going to put the order in? Like, you're telling me this verbally. So I don't know how verbal orders work at this place. Normally the doctors, they go put it in and do we see it? And then, okay, cool. They might tell us what they did, but the order by that time is already in, or they want to go put it in. So I'm walking down the hall to find the kids, because I don't know where the kids are, because I haven't done a wound culture at this place yet. I haven't done it. So I'm going down to find the stuff, and I'm halfway down the hall, and she gonna say, quickly. So I turn around. I said, excuse me. She's like, quickly, the patient's waiting. I said, oh no. I said, I'm gonna go get the house supervisor and she's gonna help you with that because I'm with the patient, which is what I should have said in the first place. You had to like you had to like set boundaries with people, because the way that was so disrespectful to me. Basically it gave me slave vibes, like clap, like let's hurry up and just get it done. Ma'am, you are the one in the rush. I'm not. I'm gonna be here for 12 hours. You come in here, you round for 30 minutes and you leave. Half the time you don't even be doing what you're supposed to be doing. But do I say anything? No. When these patients complain about you to me because you're rushing patient care and not listening to the patients, do I say anything? No. But I'm about to start, because technically we're supposed to advocate for the patient. This lady, so I go get the house supervisor and I go to her what's going on, and she's looking at me crazy, and I'm like, yeah, I'm gonna let you deal with that. I'm going to finish what I was doing, because she interrupted me about 10 times. So I go in there and my patient's like, if she comes in here one more time, I'm going to tell her off. And I was just like, don't do that. But I do the wound care for that lady, and she's like, okay. She comes in and it's already done basically. She's like, I don't like how you wrap that or how you put the dressing on there. And I had to tell her, like, the patient didn't like the way you did it. Basically the way you did it made her feel uncomfortable, so I changed it a little bit. But from what I did versus the orders are not too much different. And the lady's like, I just don't think she likes the fact that she wasn't able to do it. I said, who cares? Because at this point, who cares? It's done. So mind you, the day before I was helping her new wound care on this same lady, and she has an ACE wrap order. She told me I wasn't wrapping the ACE wrap tight enough. The lady told me that the ACE wrap was too tight. So mind you, the next day I come in, the lady was like, first of all, I had gotten a report. We don't do bedside report, if you're wondering. We don't do bedside report. We do it like at the nurse's station. So I go to check on the lady, and the lady's like, my legs hurt. I'm like, can I look at your legs? I pulled a blanket back and I unwrapped the ACE wrap. And when I tell y'all, This lady's legs was like blown up on 2 sides, and then in the middle it was like that because it cut her circulation off. I was like, first of all, I think she had slept in them as well, so they didn't take them off. I'm like, I think your A-strap was too tight, and I apologized, and I elevated her legs and stuff like that, and her legs went back to normal, and I kept an eye on her. But I was just like, it pays to listen to the patients. I had multiple patients that have complained on her. But anyway, I don't know anything because I'm a new nurse. I mean, I'm not that new anymore, but still, bullies are everywhere. This video is not about bullying, but I'm just speaking on my experiences in the past several months since people have been asking me for updates. And I'm telling you right now, I will quit a job. But anyways, I'm in the process of finding a PRN job because, like I said, I'm trying to go back to school and I don't really want to work full-time. I don't have to work full-time because I have GI Bill. I mean, I have the benefits from the military, so we get paid to go to school. I'm not gonna like overwhelm myself when I don't have to. So I'm just gonna get a PRN and pick up here and there if I need to. I mean, I don't really need to. I didn't work throughout LVN school because, like I said, the military paid me, but I still kind of want to work, have my PRN just to have some extra on the side, you know? Yeah, so that's all I got for now. I'll let you know if I decide to, I'll let y'all know when I decide to apply to school. I'm not going to say where I'm going to school, obviously, but I'll let y'all know, like, these things. I feel like things are going to go well. I'm going to say things are going to go well. We're going to manifest it. And I'm going to come back in the next video and let y'all know what's going on. Hopefully not 9 months from now. I'm trying to stay consistent on YouTube because I have been seeing things, like, go up. And I don't know, I really like that. So I'm going to try to stay consistent as I can. I'm just playing. Okay, yeah, I'm going to try to stay consistent. So if you made it through this whole video without clicking off, thank you so much for watching. Make sure you like, comment, subscribe, and we're going to keep this conversation going because I feel like nurse unity is needed in this country right now with all this stuff going on. Like, tell me what's going on with y'all, please. I love to hear about it, and I love to, like, network with other people. So yeah, if you watched this whole video, thank you. Like, comment, subscribe, and I'll see y'all in the next video.